having me today to help answer some of these questions.
How do COVID-19 vaccines work?
So the COVID-19 vaccines work just like any other vaccine. Essentially, our body is introduced to the virus, so that way our body can build up immunity through antibodies. So that way, if we come into contact with that virus, our body will be able to recognize and fight off that virus, and hopefully we either won't get sick or won't get as sick.
How well does the vaccine work, and can I still get COVID-19?
There is some evidence to show, yes, that even with having the vaccine, if you are exposed to the COVID-19 virus, some individuals still do become sick with COVID-19. However, the infections are not as bad.
Do I still need to wear a mask after I've been vaccinated?
Yes, absolutely. You still need to wear that mask after receiving your vaccine. The vaccines do not work right away. So, you know, with the whole COVID-19, we've learned that there's that 14-day incubation period. So you could have been exposed to the virus, say, before or even right after you receive your vaccine. So there's still that chance you can get sick even though you just received your immunization. And if we're carrying that virus, we can still pass it to others. So if we do build up that immunity, right, after whether it's the first or second dose, and some time has passed, just the potential to carry that virus and spread it to others who may not have been vaccinated still poses that risk. So yes, absolutely, we still need to wear masks.
How long does the vaccine last? Will I need to get it every year?
We do not have the answer to that question right now. We're still waiting to, I guess, find out where this pandemic takes us. So Public Health Agency of Canada, you know, all the different public health units at every level of the government, not just here in Canada, but across the world, will be monitoring, and we'll have to stay tuned for that answer.
Why should I get a COVID-19 vaccine?
Our goal is to build up immunity within the community. We know it as herd immunity. What we want to do is hopefully more people in the community get immunized. So we're all developing those antibodies to fight off that virus. So if we do come into contact with that virus, whether it's in school, at work, anywhere in the community, essentially, right, we're going to hopefully not get sick and not continue to spread that virus. Over the years, you know, there's been many infectious diseases. The simplest way to put it is when we think of our childhood immunizations or the annual flu shot. Many schools, you know, school-age children, we start getting our kids immunized from the time they're babies right until their childhood. One of the most recent viruses that is not as infectious anymore, we don't hear about it as much, is the chickenpox. So there wasn't, once upon a time, I know when I was little, there was no chickenpox vaccine, and I had the chickenpox, my brother had the chickenpox. So now our kids have that vaccine to get the chickenpox, build up the immunity, so they're not actually becoming infectious with that virus. So it's kind of nice because it's not going throughout our schools anymore like it was, you know, 10, 15, 20 years ago. So with the COVID-19 vaccine, that's the whole idea, is the more people that get immunized, that hopefully we can fight off this virus and suppress it, stop it. And then we're protecting everybody else who, you know, essentially would have bigger complications from if they were to become sick with COVID-19.
Can I be forced to get a COVID-19 vaccine?
The answer to that is no. That's the simplest answer. It's not a mandatory requirement in the province of Ontario, nor is it a mandatory requirement here in Wikwemikong.
What if I don't take the second dose of the COVID-19 vaccine?
The first dose is not as effective if it were to only be a single dose. So it is recommended for 2 doses for both the Moderna and the Pfizer. They are given 21 to 28 days apart. And then they are 95% effective after receiving 2 doses. So again, you know, that timeline, that's been another question that we've had, is what if I receive it late? And again, that's a great question because it's been brought up in the media, right, a number of times. So we are tracking everybody who comes in to receive that first dose, and we do have it in a database where we make sure that you will also receive that phone call to book your appointment with the second dose.
Can the vaccine give me COVID-19?
No, the vaccine cannot give you COVID-19. And again, that is a great question. It can give you side effects that can, I guess, mimic COVID-19 symptoms. But that comes with every vaccine. It's not just this COVID-19 vaccine. It's not just Moderna. It's not just the Pfizer. That is accompanied by every vaccine. So vaccines do have those common side effects. They typically last anywhere from 1 to 2, sometimes 3 days, and they're usually pretty mild.
Are there long-term side effects after getting a COVID-19 vaccine?
We have been asked that many times. So currently, to date, everybody who's been vaccinated has not shown any long-term side effects. Most of the side effects are pretty short-term, and again, they do subside, you know, within a few days. And they remain mild. So it is continuing to be ongoing. Even us as nurses, we do that assessment, right, and that follow-up. So it's a part of our commitment to you guys as community members to make sure everybody's safe and feeling well, and then to help answer those questions if you know you do have any concerns afterwards with how you're feeling and things like that. So we're always available here to help with the community answering those concerns even after being vaccinated.